Are you curious about the different types of eating disorders that exist? Millions of people around the world struggle with these conditions, and they can have serious consequences on both physical and mental health. In this video, we'll explore the different types of eating disorders, including anorexia, bulimia, binge eating disorder, and others. By understanding these conditions, we can help reduce the stigma surrounding them and support those who are affected. So, let's dive in and learn more about the various types of eating disorders. Eating disorders are serious mental health conditions that affect a person's eating habits, thoughts, and behaviors related to food and body image. They can have serious physical and emotional consequences and require professional treatment to overcome. The science behind eating disorders is complex and multifaceted. While the exact causes of these disorders are not fully understood, researchers have identified several factors that may contribute to their development, including genetic, environmental, and psychological factors. Studies have shown that certain genetic and neurobiological factors may increase a person's susceptibility to developing an eating disorder. For example, individuals with a family history of eating disorders or other mental health conditions may be more likely to develop an eating disorder themselves. Environmental factors, such as societal pressures to conform to unrealistic beauty standards, can also play a role in the development of eating disorders. Traumatic life experiences, such as abuse, can also increase the risk of developing an eating disorder. Psychological factors, such as low self-esteem, poor body image, and perfectionism, can also contribute to the development of eating disorders. In some cases, eating disorders may be a way for individuals to cope with difficult emotions or life stressors. After you know what degenerative eating disorders are, let's discover the types of eating disorders. There are several common types of eating disorders, including 1. Anorexia nervosa. Anorexia nervosa is a serious and potentially life-threatening eating disorder that typically develops in adolescence or young adulthood. People with anorexia nervosa often have a distorted body image and an intense fear of gaining weight, which can lead them to restrict their food intake, avoid certain foods, or engage in excessive exercise. In some cases, individuals with anorexia may also engage in other behaviors to further restrict their food intake, such as purging or using laxatives. Anorexia nervosa can have serious physical and emotional consequences. The physical effects of anorexia may include malnutrition, dehydration, and hormonal imbalances. Over time, these effects can lead to serious health complications such as heart damage, osteoporosis, and organ failure. In severe cases, anorexia can be fatal. 2. Bulimia nervosa. Bulimia nervosa is an eating disorder that is characterized by recurrent episodes of binge eating followed by compensatory behaviors such as self-induced vomiting, laxative use, or excessive exercise. People with bulimia nervosa often feel a lack of control during these binge episodes and may consume large amounts of food in a short period of time. Afterward, they may feel guilty, ashamed, or disgusted with themselves and engage in purging behaviors to compensate for the calories consumed during the binge. The physical consequences of bulimia nervosa can be severe. Frequent vomiting can cause electrolyte imbalances, dehydration, and damage to the esophagus and teeth. The emotional effects of bulimia nervosa can also be significant. Individuals with bulimia may experience anxiety, depression, and low self-esteem. They may also struggle with feelings of shame or guilt related to their eating behaviors, which can further perpetuate the cycle of binging and purging. 3. Binge eating disorder. Binge eating disorder or BED is a type of eating disorder that is characterized by recurrent episodes of binge eating, which is defined as consuming an unusually large amount of food in a short period of time, usually 2 hours, and feeling a loss of control during the episode. This behavior is often accompanied by feelings of guilt, shame, and embarrassment. Individuals with BED may consume food even when they are not hungry, and continue eating even after they are physically full. Binges can be triggered by stress, boredom, or emotions such as sadness, anger, or anxiety. People with BED often eat alone or in secret to avoid judgment or criticism from others. BED is not just about overeating, but also involves negative emotions and psychological distress that can impact a person's quality of life. The condition can lead to weight gain and obesity, which can in turn increase the risk of other health problems such as diabetes, heart disease, and certain cancers. 4. Avoidant restrictive food intake disorder or ARFID. ARFID is a recently recognized eating disorder that is characterized by a persistent and significant disturbance in eating and feeding that results in a failure to meet nutritional and/or energy needs. ARFID is different from other eating disorders, such as anorexia nervosa and bulimia nervosa, because it is not primarily driven by a desire for weight loss or a distorted body image. Individuals with ARFID may experience a lack of interest in food or have an aversion to certain tastes, textures, colors, or smells of food. They may avoid eating certain foods, such as fruits and vegetables, or entire food groups, such as meats or dairy products. Fear of choking, vomiting, or other adverse consequences of eating may also contribute to food avoidance. As a result, individuals with ARFID may have a limited and restrictive diet that can lead to malnutrition and other health problems. Now you know about the types of eating disorders. Let's move on to how to battle against eating disorders. It can be challenging, but with the right treatment and support, it is possible to recover and lead a healthy and fulfilling life. Here are some steps that can be taken to combat eating disorders. 1. Understand the disorder. Eating disorders are complex illnesses that can have a variety of causes, including psychological, biological, and social factors. It is important to understand the disorder in order to effectively battle it. 2. Seek professional help. If you suspect that you or someone you know may have an eating disorder, seeking professional help is an important step toward recovery. A qualified healthcare professional, such as a psychologist or psychiatrist, can provide an accurate diagnosis and develop a treatment plan tailored to the individual's specific needs. The first step in seeking professional help is to find a healthcare provider who specializes in treating eating disorders. This can involve asking for a referral from your primary care physician, searching for a provider online, or contacting a local mental health clinic or treatment center. During the initial assessment, the healthcare provider will conduct a thorough evaluation to determine the type and severity of the eating disorder, as well as any underlying physical or psychological conditions. They may ask about the individual's medical history, eating habits, exercise routine, body image concerns, and other relevant factors. Based on the assessment, the healthcare provider will develop a treatment plan that may involve a combination of different approaches, such as psychotherapy and medication. 3. Be patient. Recovery from an eating disorder is a complex and challenging process that can take time and patience. It is important to remember that the journey towards recovery is not a linear one, and setbacks and challenges are common. During the recovery process, individuals may experience a range of emotions, including fear, anxiety, and frustration. They may also face obstacles such as weight fluctuations, food anxiety, and body image concerns. One of the most important things to remember during recovery is to be patient with yourself. Recovery takes time, and it is important not to expect overnight results. It is normal to experience setbacks and to feel discouraged at times, but it is important to stay committed to the recovery process. 4. Develop healthy eating habits. This is an essential part of recovering from an eating disorder. This involves working with a registered dietitian to create a meal plan that is tailored to your individual needs and supports your physical and mental health. A registered dietitian is a healthcare professional who specializes in nutrition and can provide personalized advice on healthy eating habits. They can work with you to create a meal plan that takes into account your specific dietary needs, food preferences, and any underlying medical conditions. When developing a healthy meal plan, it is important to focus on consuming nutrient-dense foods that provide the body with the nutrients it needs to function optimally. This includes a balance of protein, carbohydrates, and healthy fats, as well as vitamins and minerals. It is also essential to avoid restrictive or fad diets, as these can be harmful to both physical and mental health. Restrictive diets can lead to malnutrition, while fad diets can perpetuate disordered eating patterns and contribute to feelings of guilt and shame around food. In conclusion, it's important to remember that there are several different types of eating disorders. But the good news is that recovery is possible and that many people have undergone change. Remember, recovery is a journey, and it takes time and patience. But with the right tools and support, anyone can overcome an eating disorder and live a happy, healthy life. So let's spread awareness about eating disorders and continue to support those who are struggling. Together, we can make a difference. Thank you for watching this video about the different types of eating disorders. If you found this video helpful or informative, please give it a thumbs up, and don't forget to subscribe to our channel for more content like this.